Vaping versus traditional smoking, a health comparison. The combustion process releases a variety of harmful substances. While vaping contains fewer toxic substances and lower concentrations of harmful chemicals, the reduction in the number of toxic chemicals does not equate to being safe, particularly as the long-term effects of vaping are still being studied. Traditional cigarette smoke contains over 7,000 chemicals, with at least 70 identified carcinogens. Key toxins include tar, carbon monoxide, formaldehyde, benzene, and ammonia. These are among other known toxins and carcinogens that are byproducts of the burning of tobacco. Tar contains the majority of carcinogenic compounds in tobacco smoke. E-cigarette aerosol contains significantly fewer chemicals than combustible cigarettes, but it's not harmless. Most e-liquids contain nicotine, which is highly addictive. Propylene glycol and vegetable glycerin are used as carriers, though long-term inhalation effects remain unclear. Some flavoring chemicals, like diacetyl, have been linked to serious lung diseases when inhaled. Despite frequent claims to the contrary, the notion that vaping leads to popcorn lung is still debated. Notably, cigarette smokers inhale over 10 times the amount of diacetyl compared to vapors, yet there is no established evidence linking smoking to the development of popcorn lung. Heavy metals from heating elements may also be present in some devices. These can be emitted from the heating element of the vape device itself. The evidence is mixed regarding the presence of heavy metals like lead, cadmium, arsenic, and mercury, and may be dependent on the device being used. Traditional smoking is strongly linked to lung cancer due to high carcinogen levels. Vaping has fewer carcinogens, but long-term cancer risk studies are still needed. Smoking severely impacts heart and lung health, causing well-documented cardiovascular and respiratory damage. Smoking causes chronic obstructive pulmonary disease, stroke, and asthma. Vaping also shows potential for respiratory irritation and other health issues. The rising popularity of vaping among teenagers and young adults raises serious public health concerns. Public health advice is clear. Non-smokers, especially young people, should avoid vaping entirely. Public health campaigns and regulatory measures focus on reducing access among young people, educating the public about the risks associated with vaping, and researching the long-term health outcomes of vaping. The report from the Royal College of Physicians provides a comprehensive analysis of various aspects of vaping, including its role in smoking cessation, health effects, trends, and regulatory considerations. Vaping is mainly used by current and former smokers. Youth vaping has increased significantly, while traditional smoking rates have decreased. Evidence shows e-cigarettes can help smokers quit, with better outcomes than nicotine replacement therapy in some studies. However, long-term switching data is limited. Proper regulation is crucial to prevent youth access while supporting adult smokers who want to quit. Nicotine, whether natural or synthetic, is a stimulant. Its natural form is found in the tobacco plant, and it is the primary psychoactive ingredient in both traditional cigarettes and most vaping products. While not a carcinogen itself, it is addictive. Nicotine acts on the central nervous system, mimicking acetylcholine and triggering dopamine release. This creates its addictive properties. Nicotine increases heart rate and blood pressure, affects metabolism, and can temporarily reduce appetite. Its effects depend on dosage and delivery method. Nicotine salts in e-liquids are combined with organic acids, making them less harsh to inhale and potentially easier to become addicted to. Research on specific disease biomarkers and the impact of vaping on health, including during pregnancy, has produced inconclusive results. There is some evidence that passive exposure to vape aerosol could lead to nicotine absorption and inflammatory changes. Research limitations include inconclusive data on pregnancy impacts, unclear effects of passive exposure, and the need for comprehensive long-term studies. The key takeaway: vaping is less harmful than smoking, but not risk-free. An evidence-based approach to harm reduction is essential for public health policy.